If you're dealing with pain that shoots down your leg, it might be more than just a sore muscle. It could be what's commonly referred to as sciatica. But don't worry, in this video, I'm going to explain exactly what sciatica is, what causes it, and the best treatments to finally get relief. So let's get started. Hi, I'm Dr. Deeptee Jain, an orthopedic spine surgeon. If you've been suffering from sciatica or just want to understand what's going on with your body, you've come to the right place. In this video, I'll break down the causes of sciatica, how to recognize its symptoms, and the best way to treat it. Make sure to subscribe to this channel for more helpful spine tips. First of all, sciatica is actually a colloquial term. The sciatic nerve is actually not part of the spine itself. It is the lumbar nerve roots that come out of the lumbar spine that cause that radiating pain. The medical term for nerve pain originating from compression of a lumbar nerve root, in other words, pressure on the nerve root, is called radiculopathy. A lot of people think that sciatica or radiculopathy is just low back pain, but that's actually a common misconception. It's a very specific type of pain that affects a spine nerve root, which runs down from the back down to the back of the leg. And it's not just about the back. Sciatica is a nerve problem, importantly going down the leg. And today we'll talk about why that happens and what you can do about it. Radiculopathy refers to pain that is caused by irritation and compression of a spinal nerve root in the low back. When one of the nerve roots gets compressed or irritated, it can cause pain that radiates down the leg, sometimes even reaching your foot. This pain can range from mild to severe, and it may be accompanied by numbness, tingling, or weakness. There are several different causes of sciatica or radiculopathy, but the most common ones include the following. Number one, herniated discs. When the jelly-like substance that's inside the disc squirts out, it can press on one of the spine nerve roots. Spinal stenosis. This condition causes narrowing of the spinal canal, which can put pressure on the nerve roots. Finally, spondylolisthesis, number three. This occurs when one vertebra slips forward onto another, which also irritates and compresses the nerve. The motion especially is irritating to the nerve. The spine is not meant to move in abnormal ways. These are some anatomic causes. In other words, things that I, as a spine surgeon, can see on an MRI to put pressure on the nerve root. But remember, there are lots of other things that can cause nerves to go haywire and cause pain, but that's usually not in the wheelhouse of a spine surgeon. The symptoms of sciatica can vary, but they include the following. You could experience sharp or shooting pain, which is the hallmark symptom. The pain may start in the lower back or the buttocks and shoot down one or both of your legs. Numbness and tingling, very common symptoms. These symptoms can occur depending on where the sciatica is coming from, exactly in a specific location in your leg, foot, or toes. Weakness. Sometimes sciatica can cause weakness in the leg or the foot, making it difficult to stand, walk, or even lift things. And pain that worsens with movement. Activities like sitting, standing, bending can make the pain worse. So now let's talk about how to treat sciatica. While the exact treatment depends on the actual underlying cause, remember we talked about a few different kinds of causes of sciatica, here are some of the most evidence-based methods. First of all, physical therapy. A physical therapist can show you targeted exercises and stretches that actually might make the pain feel a little bit better and improve mobility. Medications. Over-the-counter pain relievers like ibuprofen and prescription medications can help manage the pain and reduce inflammation. Heat and ice. These are common questions that I often get. What's better, heat or ice? And the reality is we don't actually know necessarily. It's whatever works for you. Sometimes patients will try alternating between hot and cold packs, and this can help with temporary relief by reducing the swelling and easing some of the muscle tension. Next, as we go into the spectrum of most conservative care to less conservative, are epidural steroid injections. If the pain is severe and persistent, a doctor may recommend an injection to reduce the inflammation around the nerve. And finally, surgery. Now, most cases resolve with non-operative care, but sometimes the symptoms can persist. In those cases, you, as the patient, in conjunction with your doctor, might choose to undergo surgery to help with the symptoms. Have you ever tried any of these treatments? Let me know in the comments what's worked for you in the past, or if you're interested in learning more about any of these treatments. While many cases of sciatica do improve with non-operative treatment, there are times where you should seek medical attention more urgently. If you experience severe pain, in other words, pain that's unbearable and not relieved at all with over-the-counter medications. If you experience loss of bowel or bladder control, this could indicate a serious condition called cauda-equina syndrome, which does require immediate attention. Or if you're experiencing weakness and numbness, if your legs feel weak or you can't feel your foot, it might be time to see a doctor. So here's a summary of what we've covered. Sciatica, radiculopathy, is pain caused by irritation and compression of the nerve roots in the low back, often due to conditions like herniated discs, spinal stenosis, or spondylolisthesis. The symptoms include shooting pain, numbness, tingling, and weakness. Treatment options include physical therapy, medications, different kinds of injections, and in persistent cases, surgery. So if you found this video helpful, make sure to like, share, and subscribe to this channel for more spine health tips. And if you've had sciatica, let me know in the comments how you managed it. I'd love to hear your experiences.